Thank you, everyone. I feel like it's really hard to be last up in the day. There's a lot of really tough acts to follow, but I appreciate you hanging in with me. Hopefully this presentation really gives you a taste of some of the things people have been craving, which is data. And while it's one piece of the puzzle, I do have almost 20 minutes of data to show. So I'm going to be showing some of our insights from our NSIHT pilot. So our new national survey is the National Survey Investigating Hallucinogenic Trends, or I'll be calling it NSIHT. So I'm going to probably skip all the background of psychedelics because I think all the previous speakers have done a really good job of that, and just go straight into this study and some of the results. This is going to be a flavor of the types of things this study can quantify, and by no means is it exhaustive. But I will describe the study design. I'm going to talk about some subpopulations of interest around mental health in this sample, showcase two more commonly studied substances to less commonly studied substances, and then wrap up with some of the outcomes we see in self-report. And all of this is to really get a broad understanding. I should disclose that this work has been, this pilot in particular, has been funded through SAMHSA, but everything I say today are the views of me and not of SAMHSA. So I'm going to quickly go through the methods of this survey. It is a cross-sectional online survey, and it really is leveraging all of our experience at RMPDS from all the other work we've done for 15, 20 years in this type of space. It is anonymous and confidential, and it implements all of those best design practices that Dr. Black talked about earlier today with adaptive questioning, where you try to limit false positives, false negatives, all of those things. And one thing we do really well is couple front-end design with back-end analytics, and that is definitely the point of this survey. I think it's really important to understand how we're recruiting these people for understanding the data you're going to see. So there are other population surveys that exist out there, but the recruitment method is very different. So in ours, we are intentionally trying to recruit from the general population. So we are not going to Reddit forums, we're not going to blogs and trying to find the most engaged psychedelic user in the last year. We are trying to find a broad net and really capture the breadth of different use behaviors. This has been developed after a year of conducting focus groups, sending the survey through expert panel review, lived experience review, things of that nature. And I believe this survey will get iterative and reworked as we learn more and more about this space, but we put a lot of effort into the design of the questions themselves on this survey. Currently, we have a pilot to show you. It was launched in April 2024, so this is hot off the press data. A universal struggle will be funding, but right now we are funded for the first year, and we are looking to launch this 2 to 4 times a year moving forward. So just to jump straight into results, I'm going to go right into the data. We did successfully collect data from a diverse group. So we collected 2,306 survey respondents. These are all adults who reported using at least one psychedelic in the last year. We collected data on 15 different substances. So we really tried to make a comprehensive drug list and go like across the board of this space, which incorporates a lot of different types of substances. And we were able to collect at least a couple data points from all 50 states and Washington, D.C. So we already have some national coverage with these data. In our sample, we had 28.8% that reported being non-white. Below that, you can see some of the breakouts of the individual self-reported race categories. 1.9% reported being non-binary or transgender, and 28.9% reported being a veteran or first responder. So about 22% of the sample either currently or previously have served in the armed forces, and 22% are current first responders. So this survey really tried to expand the number of substances that we're capturing, but go deep on all of these substances. So there's 15 total showed on the survey, and they're all within the categories of the natural fungi or plant derivatives, molecules that have both stimulating and hallucinogenic effects, DMT and its derivatives, LSD, and then the ketamine and esketamine group. And this is the first US-based survey that put a lot of effort into intentionally distinguishing pharmaceutical from illicit products, particularly from the respondent's perspective, and can they identify correctly to reduce misclassification what they've been using. As I said, we expanded to 15 different substances, And we have uniform data collection across all of these substances, and I think this is going to be one step forward to kind of seeing the more broad scope and seeing where there are similarities and where there are differences across this umbrella that we've been calling psychedelics for the last 2 hours. So I'm going to jump straight into some of the findings. First, we're going to look at some subpopulations of interest, and the focus here will be mental health. So when you look on this graph across the x-axis, you're going to have groups of adults who have reported using each of these substances in the last year, and you're going to see what proportion in our sample reported a lifetime diagnosis of 4 different mental health disorders. So first, we can see that across all substance use categories, the highest proportion was anxiety diagnosis, and that was between 35 and 40%. The proportion of alcohol use disorder, depression, and PTSD was between 10 and 20% across all these use groups, but it varied by group. So in yellow here, this will be the alcohol use disorder, depressive disorder, and then PTSD. But we also included validated instruments for current symptomatology. So we used the PHQ-9 and the GAD-7, and we can actually categorize people as having moderate to severe anxiety or depression in the last 2 weeks and compare that to their lifetime diagnoses. So for anxiety, you see very little difference in the proportion in our sample with diagnoses versus experiencing symptoms today. Maybe a little bit of a difference in the psilocybin group with a slight decrease in symptomatology. But when you look at depression, we see a large increase in the proportion experiencing symptoms versus those with diagnosis, and now depression symptoms surpass anxiety as the highest proportion experienced in all of the groups listed across the bottom. So now I'm going to jump into 2 molecules that have breakthrough therapies, so psilocybin and MDMA, and just showcase some of the preliminary results here. So despite similar frequencies of use, we see very differential reasons for use. So this is a graph that's showing self-report of frequency of use from once in the last year in the darkest color on the left to daily use on the lightest color on the right. And psilocybin is in red, MDMA is in purple. But if you just kind of look, generally speaking, these are fairly similar in about how often people are using these substances in the last year. And we want to just kind of caution, well, I should say 20% of the psilocybin and 24% of the MDMA report about monthly use or more. But when you look at why they're using it, despite being similar frequencies, the reasons are different. And so just to highlight a couple of these, the most common for both substances, around 50%, was the fun, enjoyment, celebration reason, which I think is unsurprising, but is important to remember that is a very common use case for these substances. To showcase some differences, to treat a medical symptom was 2 times higher for psilocybin than it was for MDMA. And then conversely, to enhance sex was higher for MDMA. So people are also reporting that they're using these substances for multiple reasons. So in both of these groups, almost 50% reported 2 or more of these was a reason that they used it in the last year. So now to move on to 2 substances that are a little bit less studied, and I think there's less data on the use patterns around these. I'm going to talk about LSD and 5-MeO-DMT and some experiences around the survey respondents for these substances. So first, one thing we do see is that introduction to the market does dictate use patterns, and I think this is going to be an important lesson as this landscape rapidly evolves moving forward. But even in this data, we see that. So age of initiation among adults who are still using psychedelics today, they were able to report when they initiated substances across their entire lifetime. And so LSD was popularized in like the 60s and 70s, and 5-MeO-DMT was popularized later in the 80s and 90s. And so when you look at age of initiation for LSD and 5-MeO-DMT, on the axis, you're going to see the median age of initiation. And I'm just going to separate this by birth cohort because some of these folks weren't alive when 5-MeO-DMT came around, and some of them were. So if you look at the 2 youngest age cohorts, these are people who were born and were alive when both of these were in the culture and were popularized. You see very similar ages of initiation between the 2, between 20 and 22. When you look at age cohorts that are older, so those like born 1975 or before, or 1975 to 1984, you do see a difference where LSD was initiated earlier and 5-MeO-DMT was initiated later, closer to around 30 years old. So I do think this is something we need to think about, that there is going to be age of initiation in older cohorts for different substances as they're initiated to the market. It's not always going to be 18 to 25, although that is also an important use group. So just to showcase some other data for LSD, we asked about perceived personal growth from use of these substances. And so the exact question was, I've experienced personal growth because of taking LSD in the last 12 months. And you could strongly agree to strongly disagree with this statement. And we didn't want to just take that at face value, so we stratified this by how frequently they're using in the last year. And this is just one way we could stratify this data, but basically what you can see is people who use more than several times in the last year report more frequent, agree more often with report of personal growth. So those who have used only once in the last year, the light blue and the yellow, were neutral or disagree with this statement. We did not separate by microdose or full dose. This is just any LSD use in the last year. To look at 5-MeO-DMT, we see a little bit of a different story than some of these other substances I've talked about. So I'm going to start with reasons for use. These are the exact same list, but it's in the order of how often it was endorsed for this substance. And I think it's important to point out that none of these passed 23%. We don't have that dominating reason for use for 5-MeO-DMT that we saw for LSD, which was 40.5% endorsed fun, enjoyment, or to celebrate. Psilocybin and MDMA were closer to 50%. But this substance, we see a lot more varied intention in use. But still, people are saying they're using it for multiple reasons. But this is a much smaller proportion even for that. So 34% said they used 5-MeO-DMT for more than one reason. So we see a lot more single-use reasons and more variety of what that reason might be. To zoom in on the top two, so to improve or change self or the fun, enjoyment, to celebrate, I just want to showcase that we can actually do some of these by specific settings. So when you look at the improve or change self, we don't actually see a dominant setting either. So these are different settings people could report, and we don't see a majority. They're all kind of endorsed about the same in this sample. But when you look at fun, enjoyment, or to celebrate, we do see a majority setting, which is that private, personal setting. So in my own home, in a friend's home, a small gathering, something like that nature. So when you put these next to each other, you can see that reason for use can dictate setting. And I think this goes along with what Erica was saying earlier, like setting really does matter. And so I think it's really important that we capture these data in a multifaceted way. So now I'm just going to move on to some of the outcomes that we've seen in this data. And so these should be interpreted among our sample at the moment of adults who have used a psychedelic in the last year. So self-reported adverse events, this is not an exhaustive list of what we have on the survey, but we did see about 61.1% reported some kind of physical symptom while using a psychedelic. So that could be nausea or vomiting, seizures, or some kind of cardiovascular event. 37.9% reported that the visual distortions persisted after other drug effects wore off. 25.6% reported that they went to an emergency room or urgent care because of taking a psychedelic. 13.3% reported that someone forced sexual advances or acts on them while they were under the influence of a psychedelic. And 8.3% had someone cause physical harm to them while under the influence of a psychedelic. So to dig into some of these just a little bit, when we look at the physical symptoms, we see that the cardiovascular events are the most commonly reported in this data. Almost half the sample reported some kind of cardiovascular event in the last year. That was really broken down into 44.3% saying they had their heart was racing, they had heart palpitations, and then upwards of 25%, so 1 in 4, reported that they sought medical care because of their heart symptoms. And I do think medical care can be broadly interpreted in this population. That could be going to the ER, which we did cross with this, and there's a substantial overlap. But I think it could also be seeking out a medical tent at a festival, or it could be I chose to take a different medication to calm my heart. There's a lot of things I think that can be interpreted here, but I think this is a signal that there's room for education and there's room for harm prevention. I wanted to talk a little bit about the sexual abuse category. So there was about 13.3% of the whole sample. Acknowledging my access is shifting to 50% just to make the boxes a little bit bigger. But more than 1 in 10 had someone force a sexual advance or acts on them while under the influence of a psychedelic. While I don't show it here, an even larger percentage of people said, I don't want to say. So I think this is something that is a very difficult concept to capture, and this is a completely anonymous, confidential survey. So this most likely is an underestimate, but I do think it's really important that we acknowledge that these abuse events should be monitored. When reporting who perpetrated these events, 7.5% reported it was a partner or someone close to them. 3.9% said it was a provider, facilitator, or guided leader. And 2.2% said it was someone else. And they could check multiple of these because this was within the last year. So there are some limitations to this data, and I want to say that up front. At the moment, because this is from April, these should be interpreted as a sample. We are going to be doing a lot of the best practices to implement generalizability to this, although that is coming in the weeks ahead for me personally. Cross-sectional data as well, so these should be interpreted as current use patterns while we do collect some lifetime use behaviors. This is among people who are still using today. I don't think this will be representative of all lifetime psychedelic users. But I think that is also a strength because we will be able to monitor the evolving topic quickly. We know that there's the potential for underrepresented groups here. So in particular, Indigenous cultures, we are doing this through an online panel, which is a great way to recruit from the general population, but without certain mechanisms in place to oversample or to reach out, we're gonna have some underrepresented groups. And as we collect more data, we'll be able to do more stratifications and learn just a lot more about the use behaviors and the safety here. Some strengths I want to mention. This is a comprehensive drug list, so there's 15 substances, and it has the flexibility to expand beyond that. So as NAB finds new substances that he tells us we should be adding to the survey, we can do that. And we are doing very intentional respondent perceived differences between illicit and pharmaceutical products, and I think that's going to be really important moving forward. This survey measures safety, risks, and benefits. So while 65% of this survey is dedicated to like drug use behaviors, 35% of the survey is dedicated to understanding the person. There's a social ecological model built into this survey where we are intentionally measuring personal, interpersonal, community, and society level factors. And I think that's come up several times today where like we need to understand the person in addition to large-scale use behavior patterns. And so that is a very big part of this survey. Another big strength of this is I think we've proven that we successfully recruited from a rare population. I know everybody in this room is very curious about this group, but it is one of 4 to 6% of all adults in the United States. So it is hard to find ways to capture data here. We're doing a lot of the proactive bias control. I think that's one thing RMPDS does really, really well. We really try to do all we can on getting the most accurate data and interpreting it in the best way possible. And then we were able to collect almost 2,300 survey respondents in 6 weeks. And so I'm very pleased that this is actually an engaged population of research and that people consented to the survey and wanted to provide these answers. So that's very encouraging, I think, moving forward. But as a pilot, this is a work in progress. So this pilot also contained a host of content validity. Are we asking these questions the right way? Do people understand what we mean when we say these things? And so that is being analyzed as we speak and will be implemented into future surveys to constantly improve. We also would like to conduct a reliability study. I think the topics around psychedelics will continue to develop, and we will be flexible to that. And then, as I said, we are working on a statistical approach for bias adjustment. We want to make sure that we are saying the right things that actually apply to the larger population. So we will be working on that. Particularly selection bias is a big concern for us that we will like to adjust for. But I don't think that those strengths and weaknesses take away from these first insights on these data. So we did see differences that were observed in behaviors and experiences across these substances. So as an example, LSD, MDMA, and psilocybin had a clear primary reason for use, which is that fun enjoyment reason, while 5-MeO-DMT did not. I do think there were several unexpected responses. For me, the clear disparity in depression symptomatology versus diagnosis is a bit concerning, especially if diagnosis is what is used as the most accurate measure. The report of physical and sexual abuse, originally I was surprised by that, but after today's talks, I think I'm becoming less and less surprised by those numbers. And then 3, the populations that may be amenable to harm prevention and reduction strategies, I think are already showing up. For instance, the 1 in 4 that perceived cardiac symptoms to be bad enough that they sought out medical care. So maybe there's a place for education, intervention, access, those types of things in this population. So just to acknowledge Dr. Andrew Magni and Joshua Black, who both spoke today, they are the PIs of this project. Can't do it without our project managers, so Ellie Fox, the entire RMPDS team, and then in particular, Dr. Jen Jewell. She's the one who conducted the qualitative focus groups that really helped design this questionnaire. So huge thanks to her as well. And I'll take any questions.